Hello and welcome. My name is Rich D'Alberto, and I am honored to serve as the 2012 Chairman-elect of the South Carolina Hospital Association. Among my duties, as I transition to lead the association in 2013, is to preside over the association's legislative committee and help guide our efforts at the State House as we tackle the legislative and regulatory concerns identified for SCHA's priority agenda. It is an honor to serve you by addressing the key issues facing hospitals in our state. Issues like the Certificate of Need program, aimed at preventing massive increases in healthcare facility costs and allowing coordinated planning of new services and construction. CON allows state governments to reduce overall health and medical costs. And we must communicate to the South Carolina General Assembly the value of not only maintaining, but improving the CON program in South Carolina. Hospitals in this country have a legal obligation to care for patients that is unlike the obligation of any other business or individual. We are obligated by federal law to care for everyone, regardless of their ability to pay. Therefore, you can't apply free market principles to an industry that by law is required to operate unlike any other industry in the free world. Strengthening South Carolina's medical peer review system will also be a top priority in 2012. Like many industries, hospitals are always on the lookout for ways to improve processes and outcomes for our patient. And peer review is an invaluable tool for having an open, colleague-to-colleague review procedure to identify steps we can take to improve our services to the people of South Carolina. Through peer review, healthcare professionals can have a candid discussion about the events surrounding a medical procedure in order to diagnose what we could do better in any situation. After all, we are medical professionals. We openly discuss patient diagnoses every day and should carry that same process over to conversations concerning the health of our own performance and procedures. As the organization charged with representing South Carolina hospitals, it is imperative that we set an example of healthy living for the patients we care for. Hospitals across the nation are adopting policies that allow employers the opportunity to choose whether to allow tobacco products inside and outside the workplace. And SCHA believes that embracing this policy will promote our culture of wellness while reining in unavoidable healthcare costs across the state. Wellness policies, including the refusal to hire persons who use tobacco products, are being credited by employers in other states for stabilizing their employee health care costs. As community leaders and some of the largest employers in the state, we should be on the forefront of implementing any policy that improves the quality of life of our employees and our patients. Finally, I know that 2011 was a difficult year for many of us as we struggled to maintain our desired quality of patient services in an environment where our revenue streams to provide those services were shrinking. This year, SCHA will work with the Department of Health and Human Services to evaluate our state's current reimbursement plans and improve Medicaid managed care. As chairman of the SCHA Legislative Committee, I will work with my peers and SCHA staff to monitor any proposed changes in reimbursement or regulations concerning Medicaid or Medicare, so we can have a seat at the table of any discussions that may affect your reimbursement rates. My only request of you is that you stay involved in your advocacy updates, and we be ready to reach out to your legislator when our voices must be heard. Thank you for your time, and please be on the lookout for more updates as 2012 legislative session goes into full swing. It's an election year, and things could get quite interesting. And if you ever have a legislative concern, please don't hesitate to contact me or a member of the SCHA advocacy team. We are here to serve you.